Hello, I'm Dr. Mazhar Hussain from My Hair Clinic. How to care for your hair transplant after the surgery. The day after the surgery and minimum 12 hours after the surgery, I suggest you take a low pressure indirect shower. Let the water hit outside the recipient area. Low pressure, rinse the head quite well. Then you can take any shampoo that you like, lather it in your hands, dab it onto the recipient area, and then rinse off again with a low pressure shower. On the day after the surgery, I suggest you take 2, 3 or 4 showers like this. If you can take more, that's even better. That can help you to reduce scalp formation. From the second day after the surgery, I suggest 1 shower daily in the very same way. 2 weeks after the surgery, you can resume completely normal showers. You can rub your recipient area as you would normally. You are not supposed to be extra vigorous in your washing, and you're not supposed to be any more gentle than you would before the surgery. The first 2 nights after the surgery, you should sleep with an elevated head. If you're using normal pillows, use 2. If it's a big pillow, use 1. After the surgery, you should not do any hard physical activity or exercise for the first 2 weeks. After 4 days, you can resume some physical activity and some exercise at 30 to 50% of your normal capacity. After 2 weeks, you can resume all physical exercises. For the first 2 months after the surgery, you need to protect the operated area, recipient and the donor area from direct sunlight. If you have very fair skin, or if your skin is very sensitive to sunlight, in that case, you may need to extend the time, maybe even beyond 3 to 4 months. I hope this gave you an idea on how to care for your hair transplant. Let us know if you have any questions. Thank you.